And the pandemic, as you've heard from Dr. Doan, and as I'm sure you'll hear from the other presenters, has had an outsized impact on the development, physical, and mental health of children and youth.
A number of children's health experts testified recently at the House of Commons Health Committee. What I found interesting about their testimony is that each of them said, to varying degrees, that the lockdowns had not only a detrimental effect on children and youth health, and especially mental health, but as we'll see, that these negative effects were greater for children than they've been to adults. Now, there's 4 witnesses that came, each of them representing different health institutions, and I'll introduce them as they come up. But I think these clips are worth having a look at because it is lending more to our conversation that we've been having about some of the longer term and unintended consequences of our policy to shut down our society and to shut down our economy for over 2 years. As I've said before, I feel that our policymakers have focused almost exclusively on the acute problem of the pandemic and have been willfully negligent about some of the longer term health effects, economic effects that we're seeing now, and in my opinion, we will probably likely see for many years. But anyway, I'll show you some of these clips. They are interesting and they do add to the conversation that we've been having. The first one is from a doctor at, she's an emergency doctor at University of British Columbia, UBC. She's also a clinical scientist and she specializes in children and youth mental health. And here's a little bit about what she had to say.
Good afternoon. I'm a pediatric emergency physician at BC Children's Hospital and a health services researcher at UBC. My research has a focus on children and youth mental health care access and utilization. We've been observing a consistent 6 to 8% rise in the number of pediatric emergency department for a mental health related problem since at least 2002. This trend has maintained during the pandemic. It is most likely, however, that social isolation and psychological stress related to the pandemic significantly impacted children and youth mental health wellness that is not entirely captured through emergency department visits. The majority of participating youth reported some degree of difficulties across the psychiatric, social, and functional domains. Adjusting for all other variables, we found that older youth were statistically more likely to report severe difficulties in the psychiatric domain. In BC, during the study period, there was no universal school closure policies. However, youth who were not attending any formal educational programs, either at home or in person, at a time when school would normally be in session, were twice more likely to report greater severity in the psychiatry and youth health domains compared to youth who were in full-time in-person school.
So what I'm understanding from her is that the effect of not going to school, if I caught that correctly, actually made some of these negative health outcomes twice as likely, if I understood that correctly. And it's interesting, she noted that this has been a problem even since before the pandemic. She was tracking data going back to 2002. So she's not saying that the lockdowns caused this completely, but she is saying that our lockdown policies seem to have taken something that was already a problem and made it worse. It's worth noting as well that, as I understand it from this Commons Committee, none of these witnesses really set out to come and talk just about the impact of lockdowns on children's health. Like, that's not what the committee was designed to do. I think they're looking at children's health more broadly. But it is interesting to me anyway that all 4 of these experts from different hospitals and different institutions all said that the negative health impacts to children and youth is worse than it has been for adults. The next witness is Dr. James Drake, I believe, and he's from the Hospital for Sick Children in Toronto, and he is in charge, or he's the head of surgeries for that hospital. And some of the numbers that he talks about are pretty staggering in terms of number of children who are waiting for surgeries and how they're past sort of the ideal timing for having those surgeries. I'll let him explain and then I'll talk about it.
So the caring for children is very different than caring for adults. And as you'll see, the wait list for children is that or greater than that for adults. So in the briefing, I provided some appendices, which I will refer to now. The first one shows the surgical wait list for sick kids over the last 3 years. And because of the pandemic and the current resources we're facing, we've had a 150% increase in our surgical wait list over the last 5 years. And at the moment, 60% of our patients are beyond the scheduled ideal date for their surgery, which has increased dramatically since the beginning of the pandemic. And in Appendix 2, you can see how the distribution of cases by surgical specialty are listed. And you'll see that, for example, urology has 2,000 patients on the wait list at sick kids who are beyond their ideal treatment time. Shown at the bottom, there are 21,000 children within these 8 hospitals who are on surgical wait lists, and half of them are beyond the ideal treatment time. And finally, just to illustrate the impact of the pandemic on children, I've shown in Appendix 5 CHI data up to December 2021. And as you'll see at the bottom of the table, the delay in surgery for children is greater than that for those who are either middle-aged or older adults. So I cannot emphasize to you enough the impact that delay in access to surgical care is having for children across Canada. Thank you.
Yeah, so that's alarming that it seems that these lockdowns, according to Dr. Drake, I believe is his name, that the wait times for surgery, we know it's been a problem for all people because things have been shut down and the hospitals have been, burdened beyond what they're normally tasked with, that there's been delays in surgery and that it's even more acute for children and youth. If I caught those numbers correctly, I think he said 20,000 children waiting for surgeries, and half of them are now beyond the ideal date for that surgery. That is pretty alarming, and I think that's obviously going to affect the lives of these children, perhaps in some cases for the rest of their lives. I don't know the particulars, of course, but certainly it's going to have some impact to the future generation. This next clip is from, I believe, he's an administrator at, he is from this is Alex Munter, I believe. He's, I think, the president of CHEO, which is the Children's Hospital of Eastern Ontario, so for the Ottawa area. And here's what he has to say about the effect of the pandemic.
And the pandemic, as you've heard from Dr. Doan, and as I'm sure you'll hear from the other presenters, has had an outsized impact on the development, physical, and mental health of children and youth. And we owe them, and we owe our country, a singular focus on addressing those needs, and again, as I say, putting them on the path to lifelong health.
So that's alarming. It seems that, if I'm following this correctly, they're saying that although people's health has been impacted across the board, that it's a particular problem for children and youth, and that's disturbing. It seems that now I think all people, all their lives do matter, whether young or old. I think all human life is precious and should be preserved and should be dignified. That's just something that I believe. At the same time, though, it seems that perhaps in an attempt to preserve life to people who are toward the end of their life, who are older, and again, not to mitigate or not to minimize what's happened to them. I know lots of people have lost loved ones who were older, but it seems like, whether consciously or indirectly, what we've done is, in the name of preserving life toward the end of one's life, we've asked kids, we've asked children, or we haven't asked them, but we've told them that they're going to pay the cost for these policy decisions. That in order to preserve life for people who are aged, we're going to shut down hospitals, we're going to shut down elective surgery, we're going to shut down the economy, and we're going to place that burden on the next generation, which to me is a reprehensible thing to do as a society, to ask children in the next generation to pay this price. Anyway, I'll move along to the next clip, and this is Squires. I forget his first name, but he is with he's with McMaster Health Sciences in Hamilton, McMaster's Children's Hospital specifically. And I believe he's the president of the actual hospital. So here's what he has to say.
Our teams and the families are worried that what they see and experience directly is not recognized by the public nor by our leaders. Our mental health teams see the children who've been waiting as long as 2.5 years to access specialized mental health services. Our child development rehab teams struggle to support parents of children needing school-based rehab as they wait 3 years for those. And our inpatient teams struggle to provide care to critically ill children and youth following suicide attempts, overdose and substance use, and severe eating disorders. And now, as you've heard, Canada's children and youth have borne the brunt. Their development, physical, emotional, social, spiritual, has been impacted severely by learning loss, reductions in access to physical activity, social isolation, and delays in access to care. And again, the data are striking. You've heard from Dr. Doan about the mental health of Canada's children. McMaster Children's Hospital, we've seen a doubling of admissions to our inpatient wards for treatment for substance use disorders, and a 90% increase in admissions to our eating disorders inpatient treatment unit. Think about that. Here at MCH, nearly 2/3 of parents of children waiting for surgery have already seen their kids miss the recommended window.
So again, they're in Hamilton. It sounds like surgeries are being delayed. Significant increases in, hopefully not deaths, but perhaps deaths as well. But we talked about this idea of deaths of despair as an impact of these lockdowns where people are isolated, turn to drug and alcohol use. I don't know if I caught all the numbers, but did he say it was a 90% increase in eating disorders and a doubling of substance abuse, if I caught that correctly. So these are significant prices that we're paying. And my sense is we'll continue to pay for these as a society for years to come. Now, what's interesting is our Deputy Prime Minister, Chrystia Freeland, recently also testified at one of these Commons committee meetings. And just on that note, these committee meetings are open. They're available online, so anyone can go and watch them. A lot of them are pretty boring. You have to sift through a lot of stuff to kind of find the news in there. And unfortunately, I guess normally our mainstream media would go to these committee meetings and find things like this and bring it to our attention. They don't seem to be interested in doing that so much these days. But the good news is, because of technology, anyone can go on and have a look at some of these committee meetings. If you're a Canadian citizen, or even if you're not for that matter, I think paying a little bit more attention to the way government works might actually help us get better people in government in general. But at any rate, our Deputy Prime Minister was testifying at a Finance Committee meeting recently, and she talked about, I guess, the need to shut down the economy. And I'll let her say what she's going to say here, and then I've got some comments about that as well. So here's the Honourable Deputy Prime Minister Chrystia Freeland.
The careful balance that the government must find right now as Canadians grapple with inflation, as the Bank of Canada fights inflation, is quite different from what we needed to do when COVID hit and we had to shut down the economy. When COVID hit and we as a country decided we're going to close things down to save lives, and we did save lives. A study led by David Naylor over the summer showed that 70,000 additional Canadians would have died had we suffered U.S. levels of mortality. So we did the right thing. But we actually all collectively said, I'm getting there, okay? But it's an important contrast. We collectively said we need to shut down the economy. And in order to ask people to do that and to prevent economic scarring, it was necessary for the government to put a floor under the economy, to support businesses, to support households. The inflation and affordability challenge is quite different. We cannot fully compensate every single Canadian family and every single Canadian business for the higher costs of inflation. If we did that, it would be this Sisyphean struggle, and we would be pumping huge oceans of money into the economy and making the Bank of Canada's job even harder. That's why
Well, Minister,
we're being
I'm really glad you
careful
raised the
of
Bank
how
of
we
Canada.
characterize
Thank you,
what
MP
we're
Albus.
doing.
And
Okay, a lot to unpack there. So first of all, just for some context, she was testifying at the Finance Committee, talking about inflation and and the government's response to it. But she says a number of things in there that I find interesting. In no particular order, I guess one thing she talks about is how there is this need that we needed to shut down the economy. I'm not sure if that might be her opinion, but I don't know that is sort of established fact that it was necessary. In fact, it seems that the more information that comes out and we see how, most people got COVID at least once or twice by now anyway, that perhaps there wasn't a need. Perhaps we would have ended up here anyway. But she says a few other things that I'm trying to remember the exact words. I think she said that collectively we decided to do this. And with all due respect to the Honorable Deputy Prime Minister, that's not exactly how I remember it. I seem to recall that there were political people who basically foisted this on the populace, and I count basically both sides of the political aisle here. Here in Ontario, the Conservative Doug Ford government, I think also acted reprehensibly in terms of taking away civil liberties, abdicating his own responsibility to govern and abdicating it to healthcare experts and sort of putting them in charge. And it's a little bit difficult to hear this from our Deputy Prime Minister. She makes it sound as though we all kind of came together and decided this collectively. Now, some people might be saying, well, she did talk about a report by a David Naylor where, according to this report that I looked for, I couldn't find it. It doesn't mean it doesn't exist. I'm sure it exists somewhere, but I was curious to look at the particulars of that report. But she says that David Naylor's report suggests that because we did these lockdowns, we saved 70,000 lives. And perhaps there's some credence to what she's saying in that respect. And some people might ask, well, how do we expect our politicians to be able to weigh these complex things? We've got 70,000 people dying if we don't lock down, yet here we're getting evidence of increased mental health problems with children and youth, delayed surgeries, and that's going to have ongoing problems. These are complex things, and people are saying, well, Peter, how could you expect our politicians to weigh these things and get it right? And I guess my answer to that is that's a very good question and a very good objection. In fact, I don't think there is anyone who is fully capable to weigh all those things perfectly and have a perfect outcome. I think even if we go back in time and we had politicians of really good character and really poured themselves into this and did the best, I think we would still have some bad outcomes, no doubt. But that's not exactly what happened. I think the way you get to the best outcome, at least in a democracy, is you allow dissenting voices to argue with one another, to have people say, well, yes, we could save people in hospitals, but what kind of impact is that going to have on children's mental health? And what about the economy and things like that? Like fulsome debate about a complex issue. But that's not what happened. Instead, we had one narrative that became the official state narrative. It was almost like a religion. We had politicians on both sides of the political aisle abdicate their responsibility to govern and basically anoint these medical experts as COVID czars. Anyone who questioned this narrative, it's not only that we didn't encourage debate, we tamped down anyone who was speaking out. University professors losing their job because they spoke out against certain measures. Police, firefighters, nurses being fired for not abiding by the dictates of the government. Not really from the legislator as far as I recall. I think these were all sort of executive branch dictates coming from various levels of government. We had social media, again, tamp down and squelch any sort of dissent. So we couldn't have this discussion. We couldn't have a full and free debate. Instead, we had one narrative. We had the mainstream media pushing that same narrative, and therefore we couldn't, as a society, even begin to weigh the various complexities of a complex issue like a pandemic. And that's what I think we need to be, repentant of as a society. We were in this bind. I believe that the COVID pandemic was real. I think it was a significant threat to us. I believe we didn't know a lot about it and perhaps still don't know about it. But our reaction to shut down debate and to fire people who dissent, like when has that ever been a good thing for society to do? So I think we need to stop and look at how this panned out and ask questions of our policymakers, both liberals and conservatives, at the provincial level, at the federal level, and look at some of these policies and irrespective of what they say their intended consequences were, what the actual consequences were of their actions. I'm reminded of a passage in the Bible. I have it here somewhere, that I think speaks to this. This is from the book of James, which was one of the courses I took in the spring term. So let me just find it. This is James chapter 4. So this is a New Testament passage here. Now listen, you who say, today or tomorrow we will go to this or that city, spend a year there, carry on business and make money. Why, you don't even know what will happen tomorrow. What is your life? You are a mist that appears for a little while and then vanishes. Instead, you ought to say, if the Lord's will, we will live and do this or that. As it is, you boast and brag. All such boasting is evil. And I think without getting too much into the text here, but I think the purpose of that, or the message that the author is trying to get across, is we make big plans. We say we will do this thing in a year's time, or we'll take this action that'll have a certain impact. And we often do this with hubris instead of humility, where we presume to know the consequences of our actions, when really we don't even know what's going to happen tomorrow. I think that's certainly some wisdom that our policymakers can take. We say that we know how things are going to turn out based on our actions, but realistically, we live in a complex world. It's impossible for us to know how things will turn out. That's why it's important that we come together as a society, that we have fruitful debate so we can move forward and check our thinking at each step. So as soon as we start shutting down dissent and censoring people who disagree with us, then we're just inviting problems. And unfortunately, it seems in this case here, it's children, among other people, who are going to be paying the price for that. And I think as a society, we need to think long and hard about that, because it's not the type of society that I want to live in, where because we've got our own ideas of how we think something ought to go, that we are going to make these decisions that have consequences on the most vulnerable among us. Anyway, let me know what you think. Tell me if I'm on the right track or maybe I'm missing something here. Appreciate you watching to the end. Thanks.